The Suicide Prevention Resource Center is funded by the Substance Abuse and Mental Health Services Administration, and it's a great pleasure to work with Brandon to collaborate to support all of your efforts around the country as best we can. Of course, what I'm going to say today does not in any way reflect the views, opinions, or policies of the federal government. So we all thought that we would be talking today in the same building, in a conference space all together. But instead, we find ourselves joining from a variety of buildings around the country and across the world, in fact. And some of you may be in a house like this one, or apartment building, maybe somewhere in the world you're lucky enough to be able to go into your office today. But I think none of us, no matter what kind of building we're in, are thinking about the foundation. We think a lot probably about how the house is decorated or how our apartment, the noisy neighbors upstairs, we wish the walls were thicker, but we don't really think about what's holding that building up both now and hopefully for many years to come. And if the foundation fails, the whole house is at risk. It doesn't matter how beautiful the floors are, how strong the roof is, the house cannot stand. So today I'd like to ask you all to think of suicide prevention as a house that we're building together. We're building it with passion. We're trying to build it better every day because we know that rates are going up. We're doing a lot of things to build this house, a lot of different parts of the house. We're doing research. We're implementing prevention programs. We're training thousands of people. We're building new partnerships. We're providing peer supports. We're offering evidence-based treatments and many other things. And those are perhaps the walls, the ceilings, the insulation, the roof of our house that is suicide prevention. But I think very few of us are attending to the foundation of that house that we're building, even though that is what is ultimately going to keep this house standing, hopefully long into the future. So even as we're each doing our important work to build those other critical parts of the house, we all need to be playing a role in strengthening the foundation. And today I'd like to talk to you about a critical part of that foundation for suicide prevention, which is state suicide prevention infrastructure. Now, for those of you in the United States, I think we've all seen with this pandemic, the importance of state infrastructure to respond to a public health crisis. For instance, the state's ability to quickly access data, to coordinate the health system response, to leverage resources where they're needed most. Well, suicide is also a public health crisis. But when we look at that critical state level that has been so important in the COVID-19 response, unfortunately, it's rare that the infrastructure is strong enough to support our important work over time. Now, some of you may know that there's more to constructing a building foundation than digging a hole and pouring a bunch of concrete in. You need proper drainage, you need the slab and the footing, you need walls with rebar, you need insulation, and many other things. And so similarly, today, I'm going to talk to you about 6 key pieces for a strong state infrastructure that can provide a foundation for suicide prevention in the years and decades to come. Number 1, states need to have the authority to coordinate suicide prevention and keep things moving forward. Have you ever tried to build a jigsaw puzzle with friends or family only to discover that some of you are working on the exact same section and sort of stealing the same pieces from each other without anyone really coordinating who's doing what? Well, similarly, multiple state and local entities, organizations, individuals are working on suicide prevention across the country. And while their efforts are with the best of intentions, if there's no coordination or plan guiding them, we may end up competing for limited resources or even duplicating efforts. And in our field, we know we need to make every limited dollar and volunteer hour count. Well, what if there were a lead entity at the state level with the authority to bring together diverse stakeholders to create and update a shared suicide prevention plan for the state, to engage other state and local agencies to streamline efforts and braid funding so we can stretch the resources we do have as far as possible, to bring new partners and sectors to the table, and to support community suicide prevention efforts. In Virginia, the state legislature passed a bill in 2018 that appointed their Department of Behavioral Health as the lead agency for suicide prevention. That legislation also mandated that the department collaborate with a number of diverse partners like community service boards, behavioral health authorities, state and local departments of health, the Department of Aging, and many others. And the bill also holds that Commissioner of Behavioral Health accountable, requiring annual reports to the governor and the General Assembly on progress in state suicide prevention. Number two, we need to provide resources for states to lead suicide prevention. I want you to imagine for a moment you're the state suicide prevention coordinator. Some states don't have anyone assigned to this role, but most states have a person at least, although often they're also assigned to other responsibilities in addition to suicide prevention. So that means there's just you, or maybe just a part of you, assigned to coordinate with state and local partners to implement and update the state plan, to look at data on suicide across the state, to monitor for new high-risk groups or regions that may be emerging, to, in many cases, respond to news media inquiries, to respond to legislator requests for information, to support community suicide prevention, and often to be there on the ground with communities after a suicide death has occurred. There are a number of our colleagues across the country that are doing their best to pull all of this off, but honestly, it's a Herculean task. So what if our state suicide prevention coordinators were equipped to succeed with a team of people focused on suicide prevention that had access to the training and resources they need to best support stakeholders, partners, and communities in bringing the latest tools, best practices, and state resources to support those local suicide prevention efforts. And Nevada has made slow but steady progress towards this. They created their suicide prevention office in 2003 with 2 staff positions, which is pretty impressive, especially at the time. Since then, the office has grown to a suicide prevention team of 7 people, funded through a combination of state appropriations, the Fund for a Healthy Nevada, and ongoing federal grants. Number 3, we need to find lasting ways for states to partner with key sectors and stakeholders. We all know that suicide prevention is everyone's business, but often we don't have all the people we need at the table. Sometimes other agencies, sectors, or organizations might not see suicide prevention as their job. They leave it to that state agency that's been given the role. In other cases, those most impacted by suicide may not be at the table to help shape suicide prevention efforts across the state and influence how resources are allocated. What if the state could create broader, more inclusive, lasting partnerships, something like what the National Action Alliance for Suicide Prevention is now, but at the state level, where public and private partners can come together and commit to doing their part to advancing suicide prevention in their sphere of influence. Sorry, my slides are slow. The Suicide Prevention Commission of Colorado includes some of the traditional suicide prevention partners we might think of, including mental health, public health, first responders, and education. but the legislation that created the commission also mandates participation from some different kinds of partners like employee assistance programs, the agricultural and ranching industry, the oil and gas industry, and interfaith organizations. Number 4, we need to better use existing data to examine and target state suicide prevention efforts. Data can be really frustrating in our field. There are often long delays in finalizing state or national suicide data, and there are many challenges in getting access to localized data. There is a lot of data out there. Some of it is hard to get at, and some of it is very complex and needs expert analysis to make sense of, and many states and communities don't have that kind of expertise available to them. And without data, we don't know who's most at risk, what their risk and protective factors may be, and how we can do more effective prevention. And we can't measure changes in suicidal behavior over time. So what if states had access to high quality data on suicide deaths, attempts, and related risk and protective factors at the state and local levels? And they also should have the ability to triangulate and interpret that data so that resources and prevention priorities can be guided by the data, and they can show what's changing over time. The Texas state legislature has mandated a report on suicide trends and activities in the state over the past 20 years. This report will draw on data sources across multiple state agencies and will include statewide and regional data on suicide deaths, attempts, and thoughts, looking at county-specific risk groups, changes in prevalence over time, and veteran status of those at risk. The report should be finalized very soon, and that will be sent to the legislature, but it will also provide critical information to guide state and local suicide prevention efforts. Number 5, we need to build statewide suicide prevention efforts across the lifespan and evaluate what's working. Right now, suicide prevention efforts at the state and local levels are usually somewhat piecemeal. And this isn't for lack of good intentions, but there are often constraints like funder priorities, lack of easy access to useful data, limited capacity, and perhaps others you can think of that mean that we're not generally able to implement broad lifespan approaches. And there are often very limited resources for evaluation or sharing of what is working across the state. And just like in this image, that probably means we're missing some of the pieces, and some groups at higher risk are being left behind. So what if we could create 8 multifaceted lifespan approaches to suicide prevention across each state and allocate sufficient resources? And by that, I mean both capacity building, in-kind resources, but also funding to fully implement and evaluate those lifespan programs. Utah has been making good progress toward this. They have a multifaceted state suicide prevention plan that's jointly administered by the lead state agency and the Statewide Suicide Prevention Coalition. They use their data to identify high-risk groups and risk and protective factors that could inform the prevention response. And so their lifespan approach in this plan targets those high-risk groups statewide with upstream crisis response and postvention programs. Finally, number 6, we need states to guide and support partner and community suicide prevention efforts. There is an unprecedented level of suicide prevention activity in this country right now, and communities, workplaces, individuals, and organizations are waking up to the fact that they have a role to play. But how can all those stakeholders get the supports they need to effectively reduce suicide in their communities? Well, remember that lone state suicide prevention coordinator, if there was one at all, who was wearing multiple hats and trying to respond to various demands? Well, that one person doesn't have time to learn what communities and partners need, much less to provide supports across the state. So what if states were in a position to support all state, county, and local prevention efforts in their planning, implementation, and evaluation of their important work, including allocating resources based on specific community strengths and needs? Well, New York State Suicide Prevention Office has developed suicide prevention coalition academies. They use a mix of in-person and online training to build local capacity for strategic suicide prevention planning. And then they provide seed funding for communities who've completed the training to help them launch their strategic plan. In the case that a community doesn't have a coalition, the state offers a one-day training on coalition development. So that the state is really working to help local coalitions get a good start with more comprehensive data-driven initiatives, and also strengthening the community infrastructure and providing a shared language so that counties can learn from each other's successes. So these 6 key pieces, authorize, lead, partner, examine, build, and guide, give us a kind of a blueprint for state infrastructure, a map that can help us to strengthen this critical piece of the foundation for our suicide prevention efforts. So now let's go back to all of us who are building this suicide prevention house, the walls, the floor, the roof, and so on. What is our part in strengthening that state foundation? Well, just as building a house takes many kinds of people, like planners, builders, inspectors, surveyors, and many others, each of us can be a part of strengthening our collective infrastructure. Where is your state in terms of those 6 key elements in that state's suicide prevention foundation? Are there critical gaps that you can see? Who are you connected to who might be able to help strengthen your state's foundation? Maybe by investing in a suicide prevention team or authorizing a task force that brings the right people to the table. This is a URL where you can find tools and resources at the Suicide Prevention Resource Center website to help you find ways in which you can play a part in strengthening that infrastructure. So let's be thinking about that critical foundation, and let's play a part, be it big or small, in shoring it up, even just a little. And I think together we can help to build a stronger footing to support our state and local efforts to reduce suicide across the country, so that our individual, community, and organizational efforts have the foundation they need to have a lasting legacy, and so that our hard work and passion gets baked in to save lives both now and into the future.